Hello, everyone, and welcome to Gen AI Icon. I am delighted to have with us today Prerak Garg, who will be doing a presentation on large language models in healthcare. And Prerak Garg is working for Microsoft, and he is a leader in AI strategy in cloud. He previously worked for McKinsey, studied at Wharton, is a public speaker and an author. And I'm delighted to have you with us here today. So thank you.
Yeah, thank you, Francisca. So great to be here. And yeah, it's great to see like so many people joining in as well. Uh, so I think you've already given a good introduction. So I'll sort of straight away dive into the content. And as I said earlier, like feel free to ask questions in between, and we'll have a lot of time at the end of the presentation as well to sort of engage in a meaningful conversation around it. Uh, so I wanted to touch 4 or 5 things today. I think the topic is large language models in healthcare. We'll come to it, but I just sort of take a step back and start with the paradigm shift that generative AI has caused, right? And how it's impacting productivity across different functions. And then deep dive into how LLMs are being used into healthcare. We'll go through a case study on a product that I've built and currently working on. And then finally, some challenges in using LLMs in healthcare and where it takes us. So, if you look at the history of GDP growth, uh, economic prosperity requires constant innovation. And for thousands of years, our growth was quite slow as much of the humanity was focused on agriculture. But then we started seeing some major uptick in our trajectory during the Industrial Revolution, where we made advances like the steam engine. And similar patterns were observed with electrification and eventually the IT revolution. With each paradigm shift, it accelerated our GDP growth further. Now, the challenge is how do we sustain this pace of growth going forward? And AI is the new imperative for us, which will like further turbocharge our GDP growth, economic prosperity, and so on. So it's a huge opportunity for all of us, right? It's a continuation in the series of advancements that we have made over the last, couple of centuries. And if you look at how this innovation or evolution happened, if you look back at the impact of electricity, when Edison created light bulb, it in itself did not create the productivity revolution that we saw later. The hard yards were actually put in by the later generations of innovators, people who built things like the washing machine, the television, the microwave. It was less glamorous work, but I would argue that added the most value, right? And similarly with AI, we had our light bulb movement with ChatGPT. Uh, but the next job is to think about all these second order, third order applications, which will add additional value on top of the foundational models that have been created, right? And so it's a huge opportunity for all of us. Think about these new applications which have not been thought about. But at the same time, we need to move really fast because the world is moving really fast, right? Like if you look at, again, like, the history of adoption of new technologies, it took 60 years for landline to achieve 80% penetration, right? It took internet maybe 15 years to achieve similar penetration, at least in the Western countries. And social media, it took less than 10 years. Uh, but with ChatGPT, it has captivated the attention of everybody, and it has become the fastest growing consumer application known to humanity, right? Like, so the pace of innovation, the pace of adoption is increasing fast. So if you are a AI professional, if you're working in a company where you're thinking of adopting AI to differentiate your business model, the imperative is like you need to move really fast because it's not something that'll happen over a period of 10 years, 15 years. It's basically every day there's a new innovation coming up and we need to move fast. So also thinking about like how generative AI is different than traditional AI, because I keep on getting this question, hey, like AI has been around for quite some time. We have been talking about AI for at least last 10 years, if not longer. I think the key difference is the new models represent a significant departure from the past. We are witnessing a shift from task-specific custom AI models to an expensive foundational models with broad applicability, right? So previously, AI models were designed for very specific purposes such as language translation or text summarization, uh, where each model excel in its specific domain, right? For example, there's a model to translate, say, English to German and so on and so forth. But there's very little cross application, and you had to use different AI models for different tasks. That means it was very difficult for enterprises to build AI because they had to hire machine learning engineers, and then bring data in one place and like apply AI on top of it. It was a huge undertaking and very difficult for most enterprises to sort of adopt AI. Now, what's happened is today's large language models, they have completely redefined the landscape. They have some sort of general intelligence that extends beyond predefined tasks. Like you can ask ChatGPT to do a bunch of things which it is not trained to do, right? And these models are trained on extensively large volume of internet text data, now video data, increasingly. And so they are like really good at doing a range of activities and tasks. Now, GPT-4 can translate for you, it can summarize for you, it can rewrite a statement, it can do sentiment analysis, and so much more, right? And with the recent release of GPT-4o, it can actually look at your computer screen, what you're doing, can use it as a guided coach. It can help educate your children, right? It's a very different form of interaction. It has like multiple capabilities, which are just not possible earlier. And what's happening is like with every generation of the model, like the performance is improving, right? Like GPT 3.5, it was really good on a bunch of things, but it was still like not good when it came to say quant reasoning, literature, LSAT, and so on. GPT-4 like crossed those benchmarks and improved performance significantly on a range of different standardized tests. And GPT-4o, which is recently released, even beats this. And it's the same model. It's not like a bigger model, right? Like, so what we're doing is becoming more efficient, more performant, and cheaper, right? Everything that you love about tech, it's becoming cheaper, it's becoming better over time, and it's moving really fast. Like, GPT-4 literally came almost 12 months ago, and now we have GPT-4o, and we'll have GPT-5 very soon. So we'll continue to see these performance improvements as we move along. And one major difference between large language models and traditional AI is like its broad applicability across multiple industries. Like on the chart, you see on the y-axis, you have applicability of LLMs to key tasks in specific industries. So for example, percentage of tasks that will be impacted by large language models. And then on the x-axis, you have the US GDP contribution, right? And what's interesting here is like, traditionally when we used to think about AI, we used to think about industries like manufacturing, transportation, like autonomous vehicles and so on, right? Uh, but now with large language models, industries like finance and insurance, professional services, information, technology, even healthcare, right? Like traditionally, we've never thought about like healthcare will be impacted so much by large language models. But these are the industries which are getting impacted the most, and these contribute the most to the GDP. So what it means is the whole economy will be transformed majorly because it's impacting every industry, including industries which we never thought will be impacted so much. And finally, like the other paradigm shift is like it's completely changing the way we interact with computers. Earlier, humans had to adopt and learn how to communicate with computers through code. For example, in the very early days of computing, we had to interact with computers using manual or physical way, using punch cards, and producing those punch cards was a very it's a very manual task. Over time, we abstracted this to machine. language and assembly language. While these were still more usable than the punch cards, they were still very difficult languages to learn and use, as they were meant to be read and executed by the computer. And eventually we evolved to higher level languages like C, C++, Java, right? Which created further abstraction, made it easier for people to sort of learn these languages. And now we have 30 million developers in the world. And that literally caused the whole information revolution, because now computers became usable. A lot of millions of developers can build interesting applications on top of it, and so on and so forth. Now we're going to a different paradigm altogether with Gen AI, with our natural language becoming the new programming language in a way, right? And instead of us learning the computer language, now computers have to learn our natural language. And what it means is every person in the world can become a developer. We are not there yet, but that's the direction we're moving towards. Like, instead of having 30 million developers, we'll have a billion developers in the world. And that is completely going to upend how the software industry looks. And there will be like insane amount of innovation that is going to happen because of that. So what it all means, and sort of summarizing all of it, is it's basically impacting productivity. AI will turbocharge the productivity of human race in ways that we have not imagined so far. And I want to talk about a few use cases from other industries, from other spaces, before we deep dive into how large language models are impacting healthcare, right? So if you look at GitHub Copilot, this is probably the fastest growing AI product that we have built. And for people who don't know what GitHub Copilot is, it's an AI programmer, pair programmer. So for developers writing code, it gives them code suggestions in line. It can also write whole block of code. It can help you test the code, find vulnerabilities, and so on and so forth, right? And millions of developers are already using it globally. So, and in people who are using GitHub Copilot, 46% of their code is now written by AI, right? Uh, so by simply pressing a tab key, a developer using Copilot can finish a line. As I said, like they can generate the full block of codes and so on. And when customers are using Copilot, we can actually track how often they are pressing the tab key, how often they're accepting the code that is written by Copilot, how many lines of code Copilot is writing. And 46% of that code is now written by AI. And similarly, developers using GitHub Copilot, they're 55% faster. This is based on a 2000 developer survey, uh, right? Specifically, developers who are using GitHub Copilot took on an average 1 hour and 11 minutes to complete the task, while the developers who didn't use GitHub Copilot took 2 hours and 41 minutes. And the same survey showed that developers who are using GitHub Copilot, they're like 75% happier, more fulfilled with their job, right? The other survey talked about like how it's impacting, say, other professions. For example, highly paid consultants, even they find AI very valuable. Consultants who are using AI, they finish 12% more tasks on an average. And not only that, it enabled them to do more tasks. It completed tasks 25% faster, and the quality is not sacrificed for speed. In fact, it's boosted by 40%, showcasing AI's ability to sort of elevate the standard of work. And more interestingly, in this study, which probably doesn't show up in the chart, is it closed the skill gap. Like AI actually helps people with lower skills more than people who are already highly skilled, right? Like, so it can actually help a low performing employee to sort of match up performance and close that skills gap that you might have in your company. And it's in a way like democratizing skills and intelligence as well. So as a result, like we are entering into an era of co-pilots. Like people are using co-pilots side by side with their work. We have DAX Copilot, which is the Copilot in healthcare. We'll talk extensively about it in this presentation. It's helping physicians save time, prioritize quality over care, quality care over documentation, It's enhancing the clinical efficiency. And moreover, like it's giving them some time back to improve their work-life balance because they have been like severely burnt out, right? We have GitHub Copilot for software developers that we talked about. We have M365 Copilot, which is the Office Copilot. I don't know if you are already using it, but this can help you write emails, summarize emails, build presentations, give you prompts for chat conversations, and so on. They're helping you like being more creative, productive with your work on a day-to-day basis. And similarly, we'll have Copilot for sales and like, security and so on and so forth. So basically, we're moving into a world where we'll have a co-pilot for every function, for every task, for every activity. I think what'll happen is you'll have a co-pilot platform like that'll become the new operating system, if you will, right? And then you'll have co-pilots for different functions, maybe different industries or tasks, and you'll be able to customize to your individual preferences, right? Like, for example, you want to write email in a particular way, you have a particular style, tone, the co-pilot will be able to learn your specific preference and write emails or suggest uh, drafts based on your own individual preference. And we'll see it across all the co-pilots. So I just wanted to give you a lay of the land and how Gen AI is evolving, how it's impacting productivity, what's the paradigm shift that we're talking about. Because I think it sets a good context for the next part of the conversation, which is focused more deeply into healthcare. Because there has been a lot of talk about how Gen AI will impact healthcare, but I feel the biggest impact on healthcare is not on the clinical decision-making side of it, which it's not replacing doctors, but it's more on the productivity side. Like, can we help doctors being more productive? Can we reduce the mundane tasks that they're doing and so on and so forth? And same for like other care workers, including nurses, physician assistants, and so on and so forth. So LLM, I'll take a brief pause and see if anybody has any question before going into this section of the talk. Okay. All right. I'll continue then. So how LLMs are being used in healthcare. First of all, you might have heard about protein folding. Till a few years ago, it was imagined to be an unsolvable problem. There are more than 200 million proteins, and it's a very complex problem to predict how certain proteins will fold. And it has major implications for drug discovery, understanding human health, and so on and so forth. Right. And it was not solvable because, yeah, it's very complex. You have these very complex protein structures, and they can take multiple forms and shapes, and it's difficult to predict. A few years ago, Google's DeepMind built an AI model called AlphaFold, which is able to predict literally every molecule, every protein known to human race in the world, right? Like, so what you see on his screen is the 3D structure of a protein which makes up the egg yolk, right? Now, so this problem is already solved not using large language models, right? It's solved a couple of years ago using a different architecture. But the problem was it was very inefficient, right? It took hours to sort of predict a protein, and like you can brute force it, but then it becomes less usable if you're doing medical research and you're trying to discover new drugs because you need speed, right? So recently, Facebook, or now called Meta, they came up with their own model for protein folding. It's called ESM2. It's a 1.5 billion parameter model, and it is up to 60 times faster than AlphaFold, right? So that's the power of large language models, like a different architecture, but it's much faster than the traditional models in this specific case. And speed is of critical advantage here because it can improve analysis. It can improve the speed of innovation because like you can experiment at a much faster pace, try out different drug molecules, see their impact on different biomarkers, and so on and so forth. And these, so we talked about a very specific model that Meta built for healthcare, and there's a raging debate in healthcare whether general purpose models will be good enough for healthcare, or you need to build your own customized model for specific tasks. And we'll talk more about it and what the approach that I think will work out in this industry. But even general purpose models are improving at a rapid pace, right? Like as you can see on the chart on the left-hand side, from GPT 3.5 to GPT 4, there was a massive improvement in performance on medical benchmarks. And what is more interesting is like Google launched their own medical version uh, of, of a foundation model. It's called MedPalm 2. And even MedPalm 2, even though it's like trained for medical knowledge and it's a medical domain language model, it doesn't outperform GPT-4 to a great extent, right? And uh, with some intelligent prompting, you can actually make GPT-4 outperform MedPalm 2 on a range of tasks. As you can see on the right-hand side, what it does is it achieves superior performance by processing multiple responses and then selecting the best one, right? So it's a clever play of how you use large language models in a more agent fashion so that they can reason and they can select the best answer. The downside is it increases the computational cost because now you have to run GPT-4 multiple times to select the best answer, but it's giving you better answers than even medically or medical domain large language models in a way. And we need more benchmarking to determine whether or like to establish more robust performance standards, but that's one study. So there's an open debate like whether you need custom models or you need general purpose models. It seems like general purpose models are also achieving good level of performance, and as we see with every new generation, they're becoming better and better. But in healthcare, the bar is still very high, so it's yet to be seen which approach becomes more dominant. How GPT-4 is used in clinical settings. One example, I would not recommend using GPT-4 or Copilot for medical diagnosis, but I just want to give you one example. Like, it is still valuable, and we have to think about how we can use GPT-4 more intelligently in healthcare workflows, even for like clinical diagnosis, but with human in the loop. So this is a case of a 24-week pregnant patient. She reported mild COVID-19 symptoms. She asked her OB's office if she could take if she should take Paxlovid, and the OB's office stated that Paxlovid is an option if she prefers, but they suggested if the symptoms are mild, the side effects of Paxlovid might outweigh the benefits, and the decision was literally left to her, and there was no direct recommendation given. Now, she asked the same question to GPT-4, and the answer is so different, right? Like, first of all, it's more empathetic, right? It recognizes the patient situation and the complexity of the medical decision that she has to take. Second, it provides evidence. It cites NIH panel, which recommended taking Plexovid. And finally, it gives a real recommendation based on the analysis of the data and different case studies that, hey, like in your specific case, taking Plexovid might outweigh, like the benefits of taking Plexovid might outweigh the risk in your specific situation, right? And it sort of answers it with humility, also stressing the need of like actually seeing a doctor because it doesn't give medical advice. So I think it's a very thoughtfully crafted response. And I think I'm not saying like you can use GPT-4 for clinical diagnosis or taking medical advice, but I think it can help doctors and in making their responses more empathetic, and they're overburdened, right? Like so they might not even be thinking about like how to structure my response, how do I connect with patients better, how do I empathize with the situation. But GPT-4 could serve as a co-pilot, helping them, give better responses to patients, and maybe like they're missing out on something, and it can, hey, like you didn't look at this specific thing, you should look at it. So it can serve as a very good co-pilot. And that was the vision behind DAX Copilot as well. It's a product that I've worked on, built from ground up. And I'm not sure if it's a problem, so much of a problem in UK, but from what I know, like even in UK, physician burnout is a major challenge. In US, it's a major challenge because it's mandated by law for doctors to sort of document all patient visits. Uh, and So, because of that, physicians spend almost 2 hours every day completing documentation outside of their normal working hours, right? So 25% of clinicians' time is literally spent on documentation. It leads to a lot of revenue loss because documentation determines how you will charge the patients. If you don't record all the treatments that you've given, you might not be able to charge the insurance company for that. It leads to revenue loss. More importantly, it's leading to severe burnout for physicians. Around 40 to 60% of the physicians feel they're burnt out in the US, and it's costing the industry around $4.6 billion in revenue loss. Plus, there's a huge shortage of doctors in US and definitely, I think, all over the world. Uh, if I'm not understating, there is almost 90,000 physicians which we need in US by 2025, and we don't have them. And 25% of their time is being wasted in clinical documentation. So it can really unblock a lot of capacity if we are able to solve this problem. And finally, patient experience is also really bad. I don't know if it's the same in London, but like in the US, when you go to a doctor, like doctor is just busy typing notes into the electronic health record, and you feel like as a patient, the doctor is not even listening to you. Like they're so busy typing the notes into the computer that it really impacts the experience, and you don't feel that you're getting the attention that you deserve from the doctor. And like it's studies show that if you don't feel that the doctor is paying attention, people are less likely to adhere to their treatment as well. And it's not just a doctor problem, it's like across the whole workflow in healthcare, at least in the US. And from what I know, I think in UK also there is a lot of burden of documentation on the caregivers, from completing flow sheets to drafting referral letters and obtaining prior authorization from insurance to treat specific conditions or like conduct certain surgeries and so on and so forth, right? There's a huge problem across the whole healthcare value chain. Turns out that Gen AI is actually a perfect tool to solve this specific problem. And that's where we build DAX Copilot, right? Uh, what it needs is it needs a speech to text API to listen into the patient physician conversation, and then a large language model to summarize that clinical note uh, or that conversation into a clinical note, right? The patient just simply has to review it, edit it using natural language, and then submit the note into EHR. So what used to take like 7 minutes per patient visit cannot be done in like a few seconds, right? And the physicians can use it from the mobile app or desktop app or from within the electronic health record that they're all so used to using. So here is an example. What it does is it records the transcript, it records the conversation and creates the transcript of the conversation. It creates the draft summary. And as you can see, like the app is able to filter out the chit chat, banter, and all of that. Just focus on the medically relevant information in the transcript. And the doctor can always like review it, edit it before submitting it into the EHR. To give you a little bit of flavor of this, I wanted to share how it works.
Hello and welcome.
Forward to.
My name is Andrea Barrett. I am a solution consultant here.
Let me see if I can.
At Microsoft and Nuance.
It seems like I can't forward it to the relevant. That's a little bit of.
I'm also a physician assistant, and I have been for about 25 years at this point in time. I'm always really excited to talk about DAX Copilot with customers, and I'm thrilled that we're able to go through a demonstration so that you can see this amazing technology in action. So let's go ahead and just start with reviewing the mobile application. Now, you can see that DAX Copilot is located in the same application as PowerMic Mobile. Now, for those of you who aren't familiar with PowerMic Mobile, this is essentially Dragon, and it turns my cell phone into a secure wireless microphone. The clinician is very easily able to toggle back and forth between the two, And when we go over some of the workflow capabilities of this technology, you'll see why that's so important. Now, also on the mobile app is you can see a list of summaries. So these are all of the encounters that I've completed today. A scheduling feed is not required to use DAX Copilot. And so we would simply recommend that the clinician use 2 patient identifiers such as name, age, date of birth, or gender to be able to identify the recording. Now, to begin the recording, I can go ahead and press the plus button down in the lower side of the mobile application. This takes me to the screen and just makes me aware as a clinician that I need to be sure that I've gotten appropriate consent from the patient in order to use this technology. Now, for the purposes of today's demonstration, my colleague, Caitlin, is going to be the patient. We're going to go through a mock clinical encounter, and she's going to be playing Maria Gonzalez, who's 35 years old, coming in for a cough. So hi, Maria, how are you?
I'm doing okay. How are you?
I'm good. Are you ready for me to go ahead and begin the recording?
Yes.
Okay, let's begin. Maria Gonzalez is a 35-year-old female who's here today with complaints of cough. So Maria, why don't you tell me a little bit about what's going on with your cough?
So about 2 weeks ago, I noticed a little tickle in my throat, and then it's gotten progressively worse into like a deep, rough cough where I've even been coughing up some like green mucus.
Okay. Has there been any blood when you cough?
No, no blood.
Okay. And you said this started about 2 weeks ago.
Yes.
What other symptoms have you had? Have you had any fever or chills?
No, I've just had a little bit of a headache, honestly.
Okay. Do you feel like you're drinking enough fluids?
I think so.
Okay.
It's just nothing is quenching my thirst and keeping my throat nice and
yeah, it's just making you want to cough more.
Yeah.
Yeah. And any pain in your face at all? Any nasal congestion, sore throat, anything like that?
Just the sore throat. I haven't noticed any nasal congestion.
Okay. And then can you think of anything that might have caused this? Is anyone else sick?
So I went on my friend's bachelorette trip 2 weeks ago, and one of the girls came sick.
Okay. All right. So where did you go?
We went to Nashville.
Oh, nice. I like Nashville. It's a great city.
Yeah, you have to try one of those pedal bars the next time you're there because that was so much fun.
Yeah, I've seen them. I haven't been on one. I usually just go for the barbecue and the music, which is great.
Yeah.
Now, any other medical problems that I should be aware of?
I had a blood clot in my left leg about 2 years ago, so I'm on blood thinners.
Okay. Now, since you traveled, do you have any shortness of breath at all?
No.
No. Okay. And have you noticed any leg swelling or anything?
Nope. I wear my compression socks daily, so no swelling there.
Okay. And you're following up with your hematologist?
Yep.
Okay. All right. Now, I want to go ahead and just do a quick physical exam.
Okay.
I don't want you to worry. I'm going to be calling out some of these exam findings, but I'm going to let you know what that means when I'm done, okay?
Okay.
All right. I'm going to go ahead and just start by pressing on your face here. Any pain when I press on your face?
Just on my forehead a little bit.
Okay. All right. On facial examination, there's mild pain to palpation of the frontal sinuses bilaterally. Just going to look in your throat. Okay. On throat exam, the uvula is midline. No evidence of any peritonsillar exudate. On neck examination, there's no cervical adenopathy present. I'm just going to go ahead and take a listen to your heart and lungs, okay?
Okay.
On cardiac examination, the heart is in a regular rate and rhythm. I don't appreciate any murmur, rub, or gallop. And on pulmonary examination, there's chorus rhonchi bilaterally and occasional expiratory wheezing. So, Maria, what does all of that mean? That just means that you do have a little bit of wheezing in your lungs and they sound a little congested. So I just think you have pretty significant inflammation there. So let's just talk about my plan, okay?
Okay.
So for your cough, I do believe that you most likely just have a viral syndrome, like a viral bronchitis. I want to hold off on antibiotics right now, but we can go ahead and order a chest x-ray just to make sure that we're not missing any pneumonia. If your chest x-ray comes back positive, we'll go ahead and prescribe you some antibiotics. But in the meantime, this is really just going to be treated with supportive measures. I want to go ahead and prescribe an albuterol inhaler. It's 1 to 2 puffs every 4 to 6 hours as needed for any type of shortness of breath or excessive coughing you have. And then I also want to give you something to help, make it easier to cough up that phlegm. So we'll go ahead and prescribe some guaifenesin, 600 milligrams twice a day to help with any of that mucus, okay? Any questions about any of that?
Can I take all that medication with my blood thinner?
Yes.
Okay.
You can, yeah. Have you gotten a flu shot yet?
No, I haven't.
Okay, all right. So I think, we're already seeing cases of the flu, so I think that we should go ahead. So from a preventative medicine standpoint, I'm going to go ahead and schedule your flu shot. I'll see if you can get it done today. Otherwise, we can schedule it for a different time. And then for your third problem of your history of your pulmonary embolism, to follow up with your hematologist, have your INR checked regularly. I'm assuming you do all of that.
Yes.
Yeah. Okay. All right. Any questions about any of that?
No, it all sounds good.
Okay, great. Well, the nurse will come in and we'll get you checked out, okay?
Okay.
All right, good to see you.
Nice to see you too.
Bye-bye.
Bye.
So in a moment, we'll be able to see what the AI was able to generate from that conversation. We'll be able to see this information directly within the mobile application. Now, the clinician can go ahead and start editing this information directly within the mobile app, should they choose to do so. So we can see that it's already back. Let's go ahead now. Let's say I'm back at my desktop and I want to go ahead and start putting this information into the EHR. I'm going to go ahead and open up my desktop version of the application. And I can see that Maria's summary is right here. Let's just take a moment to go ahead and review what the AI was able to generate from our conversation. So it talks about how she had a tickle in her throat. It's gotten worse, coughing up green mucus, no blood with cough. She has a little bit of a headache. She thinks she's drinking enough fluid. No facial pain. She went to a friend's. Now it says here bottled trip. Now I can easily change that to bachelorette 2 weeks ago. I can easily do that using Dragon Medical One. And it also talks about her pulmonary embolism that she had, and she sees her hematologist. Now, the way that you see this output delivered to the clinician, it will be delivered in standard fashion in this standard format based on specialty. And so on the physical examination, you don't have to say the physical exam in front of the patient if you don't want to. You can always step outside of the room, press the record button, and just speak your physical exam findings. So that's one option. Alternatively, you can continue to use any macros that you've created within your EHR to augment this output. And then DAX Copilot is able to go ahead and get the diagnosis as well as the medical decision-making for each issue talked about during the encounter. So we talked about her cough. We're going to go ahead and give some guaifenesin, albuterol, schedule her for a flu vaccine, and she's going to follow up with her hematologist for her pulmonary embolism. So I think that that's a very succinct and complete note. It really didn't need a lot of editing except for the bachelorette party. If I wanted to add anything to that, I can certainly do that using Dragon Medical One. So let's go ahead and look at some of the workflow.
So I know it's a very long video. I wanted to show like some specific parts, but I'm not able to forward it to specific points. But I think it gives you the picture, right? Like it records the conversation, converts it into a medically relevant note, and just focuses on the relevant information, doesn't capture any chit chat, banter, and talk about personal life and so on, right? So this product is currently being used by tens of thousands of physicians already within 6 months of launch across the whole US. It's probably the fastest growing co-pilot product that we have launched at Microsoft. And yeah, it's like we're getting amazing feedback from doctors because it's changing their lives in a way.
Okay.
So yeah, and the results are like they talk for themselves. Like 97% of the physicians feel they're more focused on patients. 70% have reduced feeling of burnt out because it's saving them a lot of time. And 85% say that they will be disappointed if they don't have to use it, right? And how it'll evolve over time is currently focused on one use case, which is the ambient note taker. Eventually, it'll evolve into Copilot for providers, which is or Copilot for doctors in a way. So from one use case to a multi-purpose use case, for example, creating summarized patient notes or summary of patient record, like based on the past visits. So you don't have to go through like hundreds of pages of documentation. on the patient. It creates a good summary of the patient status. It can help you generate medical codes so that you can bill your insurance companies. It can, it can help you talk in different languages. For example, if the patient speaks in Spanish or German, it'll be able to help you translate their languages and so on and so forth. So moving in that direction, eventually the vision is we'll have a virtual provider. So specifically for, say, minor ailments, we should be able to sort of reduce that burden on our physicians and use AI to do some clinical diagnosis. But we are very far away from that stage, and it'll take a lot of innovation before we can reach that stage. And the thing is, when you think about AI, you can have breadth or depth, and that's the status of AI today. So you have models like Gemini, ChatGPT, and so on, which have good breadth. They can do a range of activities, or you can have good depth. So we actually built a custom purpose model for DAX Copilot, a 2.5 billion parameter model trained on 4 million patient-physician encounters. But it's really good at this specific task of understanding multi-turn patient-doctor conversations and then summarizing it by extracting the medical domain or medically relevant terms, right? So it has good depth, but it doesn't have a good breadth. Like if you ask it to do sentiment analysis or anything else on the information, it'll not be able to do it. So the challenge is, how do we go from general purpose models like Gemini, GPT-4, and very specific models like DAX Copilot's model to a more universal agent or a universal model, which has both depth and the breadth. And I think that's the key challenge in healthcare. How do we achieve that? And going deeper into the challenges of using LLMs in healthcare, there are many, right? You would have all heard about hallucinations with LLMs. So there's a huge risk because there is risk around hallucination, in patient privacy, security, a lot of regulatory concerns around LLMs. Second is cost. Using GPT-4 is still expensive. It's becoming cheaper. As I said, like it's 12 times cheaper compared to 1 year ago when it was initially launched. It's decreasing, but it's still very expensive. So if you want to use it more extensively in healthcare, in drug discovery, and so on and so forth, we have to work more on reducing the cost. Third is performance. It's achieving good performance, but in healthcare, the bar is really, really high. Like you cannot afford to have a wrong diagnosis. And that's a major challenge. And that's where the key debate about, hey, like, do we have a range of models or do we have one general purpose model which can do everything, right? Because you can have one model which is really good at, say, diagnosing cancer, but it'll not be good at other things. But then it sort of limits the scalability and so on and so forth. So that's the raging debate. Last but not the least, it's about safeguards around, like we talked about hallucinations. So it cannot omit information. For example, if you use GPT-4 for note summarization, it might skip some information. That's not acceptable. Like, if you miss the key part of the exam that the doctor conducted, or it actually hallucinated something like which was not even discussed, that's a major risk. So these are some of the challenges we still are working on, we have to address, and that's why it limits its applicability more broadly on the clinical decision making, but it's really good at helping us solve some of the productivity and uh, administrative tasks for healthcare. The other, for example, GPT-4, it cannot do medical image comprehension today. And so just to give you a little bit more color, what I meant by, like, it's not applicable for a lot of healthcare applications. It has limited understanding of the longitudinal patient data. So like for giving good clinical advice, you need to understand the patient history, right? And it is not good at understanding that longitudinal view of patient visits, patient encounters, and so on and so forth. So on and so forth. It doesn't have the awareness about the latest advancements because it's trained on past data, and like there's a lot of research which is continuously happening, and the doctors generally keep up to date with the latest in the medical field. But the knowledge in GPT-4 is a little stale, so we need to find a way to connect GPT-4 with the latest information, latest research, and so on and so forth. Finally, it might have some clinical biases and stereotypes, for example, because it's trained on internet data or like publicly available data, and we all have biases. So our biases in human society might translate into the model as well. Even though OpenAI has an amazing work in removing these biases, but some of these biases might still filter through. So talking about these challenges, the North Star vision for healthcare would be to have one healthcare foundation model, which is able to reason across a range of data across different modalities and so on, right? But that's the key, like one model that can synthesize and emulate across modalities, species. It can impute missing data, and that's it can understand the diagnostic tests and so on and so forth. So if there's one model that can do all of it, like it can speed up drug discovery, it can speed up clinical diagnosis, it can connect the dots between different things and see patterns that are just invisible to human eye, right? It can propose new experiments, it can propose new treatment journeys, and so on and so forth. But this is the hard part. This probably will happen at some point, but it's super, super hard because of the multimodal nature of healthcare data. You have RNA data, you have imaging data, you have text data, you have experimental data, you have pathological data, and it's very difficult. How do you bring all of that data together? It's not about like bringing data together, but then how do you reason on top of it, right? So this is the challenge I was talking about. Like you have multiple modalities, you have multiple scales, and different experimental systems. So how do you measure molecules and cells in a lab and yet reason about organs and immune systems and the whole organism, right? It's a massive challenge, and this challenge is compounded by the issues of proprietary and fragmented data in healthcare, alongside with the challenge of sourcing this high fidelity data across different modalities and interactions between these different modalities, right? The entire regions of the space where it's physically impossible to collect this experimental data across different modalities, which will help us identify the correlation between these different entities. So it's a massive challenge, and that's why I'm saying like it's a long way before we have a general purpose healthcare model. And so maybe it'll be something like you have a general foundation model like GPT-4 for some task, but then you'll have to build very task-specific models for some time to come before we are able to achieve this vision, which is a little bit far out. So I wanted to leave you with some final thoughts. We talked about healthcare, but the AI imperative applies across every industry, and you might be coming from different industries. So I wanted to leave you with the thought you have an opportunity to apply AI in your specific industry, and it'll impact every task that we know of, right? So for example, in financial services, BlackRock is using large language models to help predict the outcomes of earning calls. In retail, Instacart in US is using large language models to personalize recommendations and inspire customers with Ask Instacart chatbots. It can suggest you recipes, and it can, based on the recipes, identify which product you want to buy, and then create the cart for you. You have to just like review and place the order, right? So there's a lot of innovation happening, and AI will be applied more broadly across every industry, every sector that we know of the economy. And there's two ways you can use AI. You can buy AI, but you can also build your own AI. And as you think about building your own AI, I wanted to like sort of share this framework that we use when we were building DAX Copilot. And a lot of companies are trying to use AI in a lot of use cases, and sometimes they don't find a lot of value because they're not thinking about it strategically, right? Which is the use case, either internal or customer facing, where you'll find the most value for AI. And you will create more acceptability and adoption for AI. Because, you build a tool which doesn't work or doesn't create a lot of value for users, it'll not be used. So this framework, it has 3 steps. First is find it. Find it includes finding the highest value use case where it'll save the most time for the users. So if we focus on doctors, because we know the use case, it'll save a lot of time for the doctors, and their time is very valuable, right? Second, you have to balance value with time to market. We could have just built a simple product which does voice dictation, but that was not good enough. At the same time, we didn't shoot for the full automation. We still have human in the loop. We didn't try to do clinical decision making because the tech was not ready. So we limited to an MVP. We're saying, hey, like just create the node and we'll add more functionalities over time, right? Last but not the least, like you focus on few things and do really well. Like instead of going mile wide, go inch. Instead of going mile wide and inch deep, do the other way around. Like focus on few things and do that really well. Second step in the process is nail it, right? Like, so once you identify the use case, like one use case, which creates a lot of value for a high value customer, then just like nail it, right? Don't overshoot the tech. As I said, like we didn't try to do clinical diagnosis because we know the tech is not ready for it. Focus on easy to adopt use cases. Like you have to meet the customers or the users where they are, right? You can't expect them to adopt a new workflow. So we build this tool embedded into the electronic health record so that doctors, where they spend most of the time, they don't have to switch to a new window or learn a new application. It's sort of available within the EHR. And then finally, you have to test and learn, right? You have to do a lot of A/B testing. We found out that it's better to have good latency with good enough quality of node, which doctors can edit, than having mediocre latency with high quality. Because yeah, like, if you receive the node 1 hour later, it doesn't help the doctor that much because the doctor now still has to remember all the details and make sure, like, it increases the cognitive burden on the doctor to remember all the details about the patient visit. So we decided to build our own model, which is smaller and faster. And finally, to scale your application, you have to think about how it accrues value for individuals, right? So we realize that the value accrues to the physician. In this case, it also accrues to the organization, but maybe initially it just accrues to the physician because now they are able to have better work-life balance. So we targeted, or we are marketing, our branding basically focus on reaching out to physicians ground up, right? And then as you scale, you also have to think about costs because these models are expensive. They're not cheap. So if you start with, say, a GPT-4, maybe like once you have some product market fit, you might think about moving to more task-specific models to manage your costs and scale the platform a bit. So yeah, I think that's it. Final few thoughts. Like generative AI is going to be a big driver for GDP growth and prosperity, as we talked about. It's just turbocharging and its continuation in the series of innovations and platform shifts that we have seen over the last a few centuries, and which have pushed human race into new domains and more prosperity. It'll have a wide impact on healthcare, as we talked about. Definitely, I see immediate use case in improving the administrative tasks and productivity in healthcare. We talked extensively about DAX Copilot. We saw a demo of DAX Copilot. It's how it's helping doctors, uh, save time, improve their work-life balance, and so on and so forth. And at the same time, there are a lot of challenges that we talked about. Multi-modality, how do you map interactions between different modalities? How do you build that general purpose healthcare model, which has both depth and the breadth? So these are all the challenges that we are continually working on. And yeah, finally, this disruption will impact every industry, and it's an opportunity for all of us to bring unique AI innovations and create unique value for our own industry. So with that, like, I will stop my monologue for almost 45 minutes, and I'll would love to see if you have any questions.
Wonderful. Thank you so much. It looks like we have a question from Kamal, which is, can you talk about the future of of what this product looks like. So maybe what features do you have on the roadmap? You talked about multimodality. I know a number of people who are also working on team collaboration as opposed to just having your own GPT, let's say. So maybe you could speak to that. What's on the roadmap? What can people look forward to? That would be great.
Yeah. So for DAX Copilot, as I laid out the vision, we are continuously adding new features. For example, we want to launch this product in UK, Germany, and Europe more broadly because we learned like similar problems exist. There's no like regulatory or legal mandate, but doctors still have to, document the visits. So we want to add more language functionality to it, like German, French, Spanish. Second, we are adding capability to identify medical codes, at least in the US, because like we have a multi-payer system. We like every healthcare provider, they have to identify there's a specific code using which the healthcare insurance company will sort of reimburse you. So you have to extract those codes from the patient-physician conversation. And it's a manual task. Currently, you have to employ nurses and other people to do it. So you can automate that using this. So we are focusing on that. Then we're adding more natural language interface on top of it. So you're able to just edit the note using natural language interface. And yeah, like, so these are some of the capabilities, but eventually what we want to do is like, it should become the primary, interface for doctors in a way like, hey, like, you want to look at the whole patient history. So instead of going through tons of documentation into the EHR, we're able to sort of pull it from EHR and summarize it, make it easy for doctor to sort of provide better advice. Now, the North Star vision, as I said, would be like, it should be able to do some clinical diagnosis eventually, but we're not there yet. And we'll see how far, like how much time it takes us to get there.
Wonderful.
And yeah, like I think even conversation, that's a different product. Oh, sorry, one more. We are also trying to expand it to nursing. Currently, it's focused on doctors. So can nurses have similar problem? They have to do a lot of flow sheets and documentation. So can we extend it there? But the challenge there is like the clinical setting is a bit different. They are actually on the floor recording all of this. So we need to do a little bit more work there. But yeah,
Wonderful.
Yeah.
So you spoke a lot about the productivity gains. So LLMs doing certain tasks and speeding up that process. And you also spoke about automation. So I was wondering whether you could just elaborate maybe on how LLMs can be used for automation and whether that's different from robotic process automation or if it's the same thing.
Yeah. So RPA is a bit different. RPA is like, when you say you want to automate some mundane tasks, for example, data entry. So you can run RPA, show it how it is done. Like basically you have to do screen recording and it'll know, okay, like you have to go here, click this button and then enter that information there. That's how it's done. With LLMs, you can also think about automations in different ways. It's a spectrum of automation, right? Like, so co-pilots are more like, hey, it's giving you suggestions. For example, the GitHub Copilot that I talked about, it's giving you suggestions about code inline when you're writing code. But it's not automation, but it's partial automation. It's helping you becoming more productive. Now, there's a new, very cool product which was recently launched called Devin, right? It's a they're calling it the AI software engineer. So it can actually write the whole program end to end. You can, for example, say, hey, like I'm starting up this business and I want to build a e-commerce website. And these are the things I want. Give the task, it'll go figure out how to build the website, launch it end to end, do it seamlessly, right? And you don't have to do anything. So in a way, like it's automating the task of the developer. And we call these agents, right? So the word agent means like higher level of automation where the agent is able to complete the whole task. And you can do it using LLMs, but there's a lot of work that needs to be done. There are a few techniques that people are working on how to improve the deterministic nature of LLMs because currently it's very probabilistic. For agents, you need higher precision and higher reliability in their ability to accomplish a task. So that there's some work being done so that we can have more automation and some more routine tasks. But I think still a far way away from like, AI completely taking over full tasks as of now.
And a lot of the ChatGPT experience, you ask questions, you ask prompts, and you get the response. How could you also allow OpenAI to ask questions to get as much information from the patient as possible? Maybe they can take photos and start inputting that information, or what would be your suggestion there?
Yeah. So first of all, the product that I talked about doesn't use GPT-4 or OpenAI models. We built our own custom models. But yeah, ChatGPT or OpenAI recently launched GPT-4o, which is a multimodal model. It can interpret images, voice, text. And you're right, like, so that could be an interesting use case, like, because there are a lot of physical cues as a patient walks into a doctor's clinic, right? Like, how are they feeling? How are they walking, and so on. So if this model is able to interpret all of that as a patient walks into the doctor's room, that could be an interesting, evolution of this product as we think about the future.
Wonderful. Dominic, would you like to ask your question, or would you like me to ask it for you? There we go.
Okay. Yeah.
Okay.
Yeah. Hi. Very nice talk, by the way.
Thank you very much for the talk. I have one question. The transcription process, is this done locally? Does the text which is being processed during the transcription process leave the actual device? So is it sent through, I don't know, a cloud or something, even if it's secured and encrypted? And second question is the post-processing, when there is like a very difficult prompt that then analyzes everything. Is this also being done locally? And if not, where is it done, and how do you ensure that this data stays secure and yes, applies to all the guidelines that you have to keep in mind while doing this?
So it's all done in cloud, because you can't run these large language models locally, right? You require, unless it's a very small model, you can probably run it locally, but and currently it's all done in cloud, because we have all the measures to sort of keep the patient data secure, but it's done on our cloud, on customer's tenant. So it's basically secure, but yeah, like, to answer your question, yeah, it's done on cloud, not locally.
Thank you.
Great. Thank you so much, Dominic. So I have a question which is around data and preparing data for training the AI. Obviously, we're talking about highly sensitive data. When we look at GDPR, it's one of the categories that's the most sensitive. So in terms of cleaning the data, what information needs to be removed from data before it can go towards training the AI? And would you encourage anyone who's building an AI solution to look at using synthetic data?
So yeah, I think I'll answer the second question first. So definitely, maybe not so much for healthcare, but there's a lot of synthetic data being used to build and train new models. It's highly useful. In fact, Microsoft recently launched our whole new series of SLMs, 5.3. And some of these models you can actually run locally as well, what Dominic was suggesting. It has its own advantages and disadvantages, but yeah, like, for a lot of use cases, if you want better performance, lower latency, you can run these models locally. And how these models work is you train them using a lot of synthetic data, and that make them more task specific, because it's difficult to collect so much of data from the real world. So yeah, definitely synthetic data. And then the first question was, how do you remove, so you have to follow the GDPR guidelines there, right? Like, there should not be any personal information that can help somebody identify for example, this is very important in healthcare. Like, you cannot have the information, like, even if you remove the name and like where somebody is residing, you can still have some indicators which can help you point out which person you're talking about. It's very important. I'm not an expert on that specific topic, like which information to remove. That's like for privacy experts to determine. But yeah, I think it's definitely a key focus area before you build a model.
Wonderful. And could you speak to the importance of partnerships between tech companies like Microsoft and medical institutions, maybe even insurance companies, pharma, and how they can all work together?
I think that's a very important question. So we talked about foundational models, and they are generally applicable across a range of tasks across different industries. But like every industry has its own specific requirement, right? And we talked about healthcare, and we are deeply partnered with all the major healthcare providers in the US, getting the feedback and building this product. Similarly, there's a lot of data which specific companies have. For example, London Stock Exchange, we're working deeply with London Stock Exchange to build financial services products, right? They might be building their own language model specific to financial industry. And they will be building the model. We're supporting them, right? We're partnering with them. We're giving them the expertise to build the models. They might be fine-tuning GPT-4. So we're doing that to build more, fintech specific applications, so on and so forth. So partnerships are very, very important, both for data, because like Microsoft, for example, doesn't have industry specific data. And a lot of industries might not have the AI expertise to build these models. So we have to come together to sort of create value in specific industries. And that's very, very important. And to be honest, there is not a good framework which is widely accepted in the industry. It's still an evolving space. People are very protective about their data, and they don't want to share their data with large tech companies, which is like totally fair. At the same time, they struggle building their own language model. So we have to find a way or a framework, a business framework through which we can sort of have more of these joint partnerships to evolve.
Wonderful.
Yeah.
So I suppose when you're fine-tuning a model and you're cleaning the data, that can take some time to look at what data is available, clean it, make it ready. But I'm sure we'll get to a stage where applications will be built and it's real-time information. So maybe a patient turns up into the office and that conversation is recorded and transcribed, and then it goes towards training the model. So in those cases, do patients need to approve of having their confidential conversation recorded and used for training purposes?
So yeah, I think real time, anyhow, it'll take some time because it's a long, lengthy process to train these models. So real time is a little bit far out. But yeah, so again, like I'm not an expert on GDPR compliance and data privacy security, but yeah, there has to be guardrails around using confidential data. And I'm sure that at least in all Microsoft products, there's so much focus on like making sure that we are compliant, that teams are taking care of it. But yeah, patient consent is definitely very, very important in such a case if you're using their data to train a model. So yeah, I can't, yeah, like that's definitely very important, and I can't like stress more on it.
Wonderful. And also looking at this, performance and accuracy, how do you avoid mistakes going into, training the model? Maybe there's spelling mistakes, maybe there are, new discoveries, and we realize that, old historical scientific information is no longer relevant. We have to update those models. So how do you keep these models up to date, highly accurate, highly performant, and sort of decommission old models when then legacy?
So that's a good challenge. And so first of all, like you have to continuously retrain, right? Like, so you said, hey, like ultimately we should be able to train it in real time. We're a little bit far away from there because it's still a lengthy process to train these models. But like we have to continuously train, at one point GPT-4 was, its knowledge base was 1 year old or 1.5 years old. But I think they have recently updated it to December 2023. So they have to continuously add new knowledge base to these models. And interesting experiments being done, which I can't like reveal too much, but like how do you use a foundational model with search so that you always have the latest information? So you use foundational model like GPT-4 for what it knows really well, but it is also able to determine, hey, like I actually don't know about this specific thing that is being asked, and it's able to route it to search to ask that question. Like you partly see it in GPT-4 already, like it routes certain queries to Bing, but we see deeper and deeper capabilities being built into foundational models about their own limitations. And then how do you orchestrate between uh, search, maybe other publicly available databases? For example, in the medical domain, there are research databases that you might want to tap into, right? Like, so for example, if you're giving advice on some, yeah, like medical task or research task, you might want to tap into a specific data source to answer that rather than using your own knowledge base. So yeah, so some progress happening in that domain as well, and we'll see how it turns out. But that's a real problem, right? Like to keep on updating, and then the probabilistic nature of the model. Like when you're building a model, it's difficult to say like don't use this unless you are an expert in building that model. Like, but like people at OpenAI, they are not, for example, healthcare experts, so they will not know like this part or this knowledge is relevant, this is not relevant, right? Unless it's widely discussed in the public and there's a publicly available discourse on like, okay, like this past method is now obsolete, and then GPT-4 will be able to take into account. But it's very difficult to do it at a scale. And even if you're building a healthcare specific models after hiring thousands of experts, like, there are different point of views, different approaches. So I don't think like it'll always be so accurate, but it all depends on the data that you have trained it on, and like, how you sort of apply reinforcement learning on top of it. And ultimately it's about like, yeah, keep on updating it.
And do you think that wearable technology will play an important role? Because obviously when people have symptoms, they say, it feels like this. This is how I interpret what's going on. But wearable technology or sensors can actually give more accurate information of what's really happening in the body, and maybe making that the perception with the reality it could be different. So is that an important part of where we're headed?
Yeah, I think that'll be, I think we were already headed in that direction even before generative AI came in, right? Like every company, including Apple, they focus so much on healthcare and wearable healthcare tech, right? Google bought this company, I'm forgetting the name. Uh, and then Apple was always very deeply focused with its Apple Watch. So we're going in that direction. I think what will be very interesting is how do we marry this more analytical data that we're collecting from these wearable devices into these LLMs so that we make it easy for doctors to reason on top of it. Currently, there is no easy way to sort of integrate or bring this data into the EHRs and like help doctors reason on top of it. It's like it's good data, but I don't think industry has figured out how to use it. But it could be an interesting use case. Like if we build integration between these wearable devices, bring the data into EHRs, apply large language models to help reason on top of it and give summarized insights to doctors. And then, yeah, like as a doctor can say, like, this is what the patient's saying. This is how the physical cues are indicating certain things. And then this is real data and like there are past patient records. So the holy grail is how do we bring all this healthcare data into one place and then reason on top of it, some of it, which I talked about, like building that foundational model that can reason across different modalities of data.
Wonderful. So I have one last question. I'm sure you're incredibly busy and have to go. So my last question is around precision medicine. And I had an event, and we had a very interesting debate around whether we should be heading towards personalized medicine that takes into account people's genetic information or not. There are some advances happening in the Middle East, and what we sort of came to the conclusion of was that when it comes to bias, and if we were to go down the route of precision medicine and personalized medicine, it's important actually to have lots of different genetic information, so that you can see that this drug has been tested on people with a very similar genetic makeup. So that's the only way that it could potentially be ethical, rather than it's just tested on a very select group in the population. Do you have any thoughts in terms of, genetic information, personalized medicine, bias, and that it's a gray area, and we have to debate it out before we can come to a consensus, but I'd love to get your point of view.
Yeah, as I said, like bias is a huge issue, right? Like it's large language model is as good as the data on which it's trained. Like, and then you can of course do a lot of reinforcement learning on top of it to reduce the bias. Like I think OpenAI team has done a fantastic job of removing the biases in the model. But it still might be there. Like, Google had a little bit of mislip with their Gemini launch. I think they went to the other extreme altogether. So bias is definitely a challenge. To your question about personalized medicine, I think, as I said, the holy grail of personalized medicine is to sort of bring this data together, and only AI can do it, right? Like give you very personalized treatment plan. And then precision medicine is more like specific to your condition. So we can achieve that using AI. But you're right, like the challenges about having enough data, having enough diversity in data. And these are challenges, yeah, which like they were already there even before generative AI. And we need to continuously work towards resolving those challenges in biases, stereotypes, which might be built into our models. But yeah, as I said, like that's a very different problem set, right? Like we need to solve that problem to build more like reliable models. But yeah, that's a very different problem, right? Altogether. But I agree, like it impacts how much we can use these models, how effective these models will be in different settings, and so on and so forth.
So thank you so much for your time. Where can people get in touch with you? And what is your, I guess, call to action?
Oh, my call to action. I don't know if everybody here is from healthcare, but if you're not from healthcare, my call to action is like we're in the very early stages of AI, right? Like it's a lifetime opportunity for all of us to think about very interesting use cases of AI. Like we have to like completely reimagine how certain services are delivered, even in healthcare, right? Like, but more broadly across different industries. It's pretty much like how internet changed everything, right? Like how we buy products, how we plan our travel, and so on. So AI will change everything. And my call to action is just think about interesting use cases that AI, or like interesting problems that AI can solve in very innovative, novel ways. And yeah, go and like build those products and build those businesses out. I think it's a lifetime opportunity.
Wonderful. Well, thank you so much for your time, and have a lovely rest of weekend.
All right. Thank you. Thank you, everybody, for having me. And it was a great set of questions. And yeah, like really enjoyed talking to you all.
Thank you. Bye-bye.
Bye.